Hi, I'm Dr. Athre. Welcome to another episode of Innovations in Facial Plastic Surgery. Our topic of discussion today is brows. Okay? Many times patients actually come in and say, what can we do for some of that excess skin in this region? On closer evaluation of these patients, many times I find that the problem is not actually excess skin in this region, but ptosis or falling of the eyebrows. Whenever we look at women, when we see the quality or the ideal of beauty, you see women as they tweeze their eyebrows or shape their eyebrows with a naturally shaped arch. The standard of beauty in a woman is basically high eyebrows that are above the bony part of the orbital rim with a nice gentle curvature arching to the highest point out laterally. Well, as we age and as we lose elasticity in our skin, we can sometimes notice that those brows start coming down. And as those brows come down, that can give the apparition of actually having excess skin in the upper eyelid. The problem in this exact situation is that it's not really the excess skin that's the problem, but rather the falling of the brows. This condition can actually be corrected very easily doing something called an endoscopic brow lift. There are multiple different types of brow lifts, and some people have probably heard horror stories of the old way of doing brow lifts with large incisions across the scalp. First, let me put your mind at ease. We don't do that anymore. We do a specific type of brow lift called an endoscopic brow lift, which uses a camera in order to elevate the brows. The entire incision for this procedure is done through 2 or 3 tiny incisions, which are each actually less than an inch long and concealed well inside the hairline. I've actually done this type of brow lift on balding men, and it's very difficult for me to see the incisions 2 to 3 weeks following surgery. You may have also heard about other people who have used screws and all sorts of various things during their brow lift. Again, let me put your mind at ease. We have a very specific technique where we use a device called an endotine in order to elevate the brows. This device lives underneath the skin and dissolves by itself over time. So therefore, you don't see anything or feel anything, and it completely dissolves over the course of 6 months. The endoscopic brow lift is a very, very useful tool in the arsenal of the facial plastic surgeon. One of the main areas that people notice aging very quickly is around the eyes. Anything that you can do to really rejuvenate this area is a huge, huge bonus for the patient. So when you can give back that normal, beautiful architecture of the female brow back to that patient, it's really something that pays dividends very quickly. Patients can sometimes see the results instantaneously and return back to work in as soon as 5 days. The procedure can be done under local anesthesia with some sedation, or it can also be done under general anesthesia. Furthermore, the procedure can be combined with other procedures like the RT facelift. For more information about an endoscopic brow lift or any of the other procedures we offer, please look us up online at www.athresurgical.com. You can also call us at 281-557-3223 to schedule your free consultation today. Thank you very much.